saying anything. We don't very often hear about problems that people may have delivering mouth care or oral care. And that's not to say that it doesn't exist. I think it's sometimes overlooked. And so we're going to share with you today is that poor oral care can have very far-reaching effects on overall health and function. It goes beyond the aesthetics of good mouth care. Our objectives today are quite simple. I'm going to have Dr. Jablonski review with you the effects of poor oral care on overall health and function so that we have a good understanding of why it's so important to deliver good care. She's going to share with you some possible reasons why people with Lewy body dementia may resist care. And then she's going to demonstrate ways to improve the delivery of oral care to persons with Lewy body dementia. We're going to leave a good amount of time for question and answer. And I do want to forewarn you that while going through this PowerPoint presentation, Rita has some wonderful little video clips. And so going from the PowerPoint presentation to the video clip may take a minute or so. So we ask for your patience. So with that, I'm going to turn this over to our primary presenter, Dr. Jablonski.
Thank you, Anne, for that lovely introduction, and welcome. One of the things people will say is, there's so much I have to do with the person I'm caring for. Mouth care is obviously not at the top of the list. And while I understand that, I'm going to present some information as to why mouth care is important really for everybody. The first thing is, why bother? As you can see, this is a picture of a tooth with an emerging cavity. When not regularly brushed, the bacteria react with the sugars found in food and they make acid. It can, over time, eat away at the hard protective part of the tooth called the enamel, where the oral is. When it becomes damaged, openings appear called cavities. They can range from little tiny pits to larger craters, and they become discolored over time as well. The time it takes to go from pit to crater really depends on overall oral hygiene and diet. The less the teeth are brushed and the more sweets are consumed, faster the rate of acid production and deterioration. When the enamel is breached, the part of the tooth known as the dentin, this yard here, it's exposed. Dentin protects the pulp, which contains blood vessels and nerves. Once bacteria get to the pulp, you can see the arteries and veins all in here, and it provides pretty much one-way ticket to the bottom of the tooth here, where it can go from the circulation of the tooth to the blood supply of the body. And that is why a local tooth infection, also known as an abscess, can create something called sepsis, which is a dangerous overall infection affecting the entire body. Food particles and plaque is a collection of bacteria, gather at the margins where the gum meets the tooth. Routine brushing can dislodge the plaque, but insufficient brushing creates a buildup of plaque, which over time builds up even more and irritates the gum tissue. That's why folks who may not brush their teeth regularly or receive oral care will have irritated bleeding gums. These irritated gums release chemicals that are part of the process known as inflammation. Some of these chemicals in inflammation are also found in heart disease, blood vessel disease, diabetes. The gums pull away from the tooth, which you can see in that third picture. Finally, enough of the gum pulls away to expose the tooth root, which does not have as much protective enamel as the top of the tooth. These exposed roots are prone to cavities, which are very painful, and it provides another place for infection. And the infection, like we saw in the other picture, can actually travel down through the root to the surrounding bone, causing periodontal disease and tooth loss, and then ultimately travel to the rest of the body. On the other two slides, oral hygiene is extremely important because the lack of it predisposes all people, especially older adults, to caries, plaque on teeth and dentures, and ultimately periodontal disease. Older adults are more likely to develop plaque on their teeth and dentures because of reduced salivary flow. Salivary flow, also known as spit, is affected by medications, especially those used for high blood pressure, diabetes, and heart disease. Medications tend to create a very dry mouth. There is emerging evidence linking poor oral health and its consequences with pneumonia, cardiovascular disease, including stroke and heart attacks, poor blood control, also known as glycemic control, for persons with diabetes, and bladder infections. There are researchers who argue that the link between oral health and bladder infections isn't really a true link. Instead, they say that persons prone to bladder infections are usually dependent on others for care, and that's the real link. However, other researchers have run the data controlling for functional dependence, and the association remains. There are associations between poor oral health and weight loss. Care behavior, it's not something that the person with LBD does just to be difficult. Actually, care-resistant behaviors are activities that the person does to prevent, thwart, and evade care. I want to emphasize the elder is not trying to be difficult. He's actually acting in a way that he or she thinks is self-protection. And here's the thinking behind that. I would think of resisting care as self-protection. And in this picture, I have a picture of the brain. And all born with protective mechanisms wired into the brain, commonly known as flight, fight, or freeze. Now, the part of the brain that governs our perceptions of fear is this part, the lizard brain, also known as the midbrain. The structures seen here on the slide and include the big beige item here, which is the thalamus and hypothalamus, the purple structure around it, which is the hippocampus, and that little red P, which is the amygdala. As an evolutionary survival tool, we are hardwired to perceive threat and respond with fear to certain images and situations. The most common are snakes, spiders, strangers, and heights. The amygdala is emerging as the center of threat perception. The amygdala stores and moderates memories of threat. When threat is perceived, the fear response is activated, the fight or flight response. You may add as the body sweating, the heart racing, and the fear response also controls behavior, the instinct to run away or to wait or just to freeze. Persons without LBD, the red gray matter, all this part here, interacts with the lizard brain and provides explanation. So I'm afraid of snakes, and I encounter one while weeding the garden. A couple things happen. First, the midbrain kicks in immediately, and my heart starts to race, and I feel a little bit of panic. Then the emotional brain kicks in and tells me that is a 6-inch garden snake 20 feet away from you, and it's moving in the opposite direction. You are in no danger. Go back to gardening. I immediately calm down and continue to do so. But here's the thing. The amygdala and the surrounding structures are vulnerable to the physiologic changes associated with dementia. These changes affect threat perception. As dementia progresses, persons with dementia are more likely to assign threat to a neutral or non-threatening situation. So someone helping a person with LBD to brush their teeth becomes a threat. They have difficulty recognizing emotions. They are better able to recognize positive emotions rather than negative emotions, which explains why smiling caregivers are less likely to encounter care-resistant behavior than non-smiling caregivers. Goal today is I would like to present a toolbox, if you will, of strategies that you can use as the caregiver to provide mouth care with a minimum of resistiveness. There are many different approaches. One may work better than others for your family member, while the same strategy may work on Tuesday but not on Thursday. So the important thing, the take-home message, is not to get discouraged, but to keep trying the different approaches. First, I'd like to review best mouth care practices because there are some myths and wrong practices going on out in the community. First, use soft toothbrush. You do not have to have a medium to hard toothbrush because brushes will remove food particle and plaque without hurting the tooth enamel. Different brushes will erode the tooth enamel. If your one has dentures, you need a denture brush. These brushes are much firmer and can be used to scrub the dentures. Also, do not use toothpaste to clean dentures. Toothpaste has abrasives that will scratch the dentures and damage them over time. The key point is do not use ice-cold water for rinsing. As we age, there is some gum recession associated with aging, and the parts of the teeth below the gum line, because they have a thinner layer of enamel, are very sensitive. Cold water may cause pain. Pain will result in the elder not wanting to have mouth care. Also, use alcohol-free mouth rinses because alcohol burns and it also dries out the mouth. There are mouthwashes for children that do not contain alcohol, and that's also an option. Use flavors that you know your family member likes. Flossing. String floss is okay if your family member will do the flossing him or herself. As LBD progresses, that ability may be lost. In our case, we've had the best success with interdentate sticks or floss sticks. These sticks look like little white toothpicks and have a spirally brush on the end. My residents call them Christmas trees. You can purchase them at any drugstore, and we've used them with a lot of success. And I'll talk about them a little more. One idea is to allow the elder to brush his or her teeth as long as he or she wants to do so. This is ideally the best way to get mouth care done. If brush exceeds 2 minutes, you can stop toothbrushing by changing to the next task, brushing the tongue. Once the teeth have been brushed, rinse with about an ounce of tepid or warm water. Ask respectfully in short one-step commands to please spit. Once commands have been shown to reduce care-resistant behavior. And allow time for the resident to respond before completing the task. Persons with dementia may need their mouth care performed for them. If you must perform mouth care, first, place thumb between the lower jaw and the lower lip. Place the toothbrush at a 45-degree angle on the outside of the lower teeth first. Brush from the outside lower to the outside upper. Then ask the elder to open his or her mouth a little wider and then brush the inside upper, ending with the inside lower. And the now for that is you accidentally cause the person to gag. Those techniques tend to minimize the gag reflex by putting the toothbrush in too far. In these pictures, I have the use of a tongue brush. Honestly, a tongue scraper or your toothbrush both work equally well. The rationale is to remove any debris that's on the tongue, any coatings. Be gentle, know any bleeding occurs. And in the first picture, the nurse is pantomiming what she wants the resident to do, and that's actually one of the strategies we talk about a little later. As mentioned earlier, flossing is best accomplished with proximal brushes or interdentate sticks. Proximal brushes look like toothbrushes, but they have a little spiral brush on the end, and they go in between the teeth. I didn't have the older adult do it him or herself. With adults with Parkinson-type syndromes, they may need you to guide the hand, especially if there's some tremoring. If the older adult doesn't want to open his or her mouth, you can have them say E, and that will help you to get in there to floss their teeth. At the point, I'm going to swap out to a video file of flossing. In between each teeth. As you can see, there's also guiding a little bit, giving just enough support without being too obtrusive. Now I'm going to discuss specific strategies to use when assisting your family member with mouth care. First, do mouth care in the bathroom in front of the sink. If the bathroom is not an option, the kitchen sink works as well. Make sure all of your mouth care supplies are out and ready to go. A family member at or below eye level tends to reduce resistance. Family member that it is time to brush his or her teeth. Sometimes, if you have your own toothbrush, you can even say, I'm going to brush my teeth now, Mom. Come brush with me. Brush teeth together is one effective way of reducing care resistance. The person with LBD can watch you for clues as to what is going on and can follow your lead without feeling like he or she is being told what to do. Avoid speaking to your family member in a high-pitched, sing-song voice the way you would speak with a small child or pet. For example, "Hey, honey, it's time to brush our teeth." This speaking is known as elder speak, and it will cause an immediate negative reaction on the part of the older adult. Unfortunately, I see a lot of elder speak in hospitals and doctor's office when a younger person is interacting with an older adult. I know I'm getting older because I've had people engage in elder speak with me, and I can tell you from experience it sets my teeth on edge, no pun intended. And here's why. A person with LBD may forget her name. He may forget the names of his children. He may lose the ability to speak a language learned later in life. But a person with LBD will never, ever forget that he or she is an adult and will perceive the use of elder speak as an affront to his or her dignity. Furthermore, people who use elder speak often raise the pitch of their voice. As we age, we experience higher frequency hearing loss with aging. An old will not understand what you're saying if you use a higher pitched tone of voice, which adds to the confusion and to the probability of care-resistant behavior. Short, one-step, and polite requests are the best way to direct people with LBD. Respond better to gestures and pantomime when communicating. Short, one-step commands with gestures and pantomime is a highly effective way of providing oral hygiene, and you will see that in the next few videos. Refers to a technique in which you start the activity and you allow the person to finish it. A person with LBD may not be able to tell you that you are holding a toothbrush, but if you place a toothbrush in his or her hand and start moving his or her hand toward her mouth, he or she will likely start to brush his or her teeth. The nurse also used short one-step commands. She also pantomimed and gestured in addition to using the chaining technique. Is another technique that we have often used with good success. Some techniques include singing, talking about pleasurable topics such as hobbies or grandchildren, and the use of props such as stuffed animals or baby dolls. This particular resident in singing as a method of distraction. Is actually related to distraction a little bit, and it's another useful technique. And what you do is you place an activity-related item into the elder's hand while you do the mouth care. Thinking is the placement of a related object cause linkages in the brain so the person understands from context clues what is going on. With mouth, if the person's resisting, what you can do is allow the elder to hold a toothbrush or a denture cup or even an old denture while you assist with mouth care. And video helps demonstrate it a little more clearly. Strategy, hand over hand, is also effective and works in one of two ways, and it depends on the preferences of your family member. One way of doing it is to put your hands on top of their hands while you perform mouth care. Sometimes you get better results by placing their hands on top of your hands while you do the mouth care. Either way, the elder feels like he or she is doing his or her own mouth care and is less likely to feel threatened that you are invading his or her space and is less likely to resist. And we have a video clip for that as well. Let's try that. There you go. The next technique, mirror, works well when you have someone who is passive and does not want to open his or her mouth. And we've called this technique mirror mirror. And what happens is you have the older adult stand or sit in front of a mirror and you assist with mouth care from behind. Additionally, you can use any combination of previous strategies while completing mouth care in this fashion. Dentures can be tricky. It is to have the older adult remove the dentures him or herself. If dentures are stuck, especially the top denture, have the older adult puff his or her cheeks, and that usually breaks the seal. In this video clip, you saw how the caregiver can remove top dentures. The trick with dentures is to remove the lower first and then remove the upper. And the reason for that, as someone who has been bit several times by doing it erroneously, when you pull lower dentures out first, the lower dentures are the easiest to get out. So as you are manipulating the top dentures, even if the elder bites down, your fingers are trapped between a gum and a denture plate versus having your fingers trapped between two sets of teeth. It hurts. So again, if the elder is completely unable to remove his or her dentures, you'll do it. The bottom first because they're the easiest to remove. See here, first peel back the lower lip with your thumb and forefinger, then use your thumbs along the margin of the denture to pull it, and the forefingers to grasp along the edge to pull the lower dentures out. Pictures, I give a little more detail to removing the upper dentures. First, you carefully place the forefingers on the edge of the upper denture, which you saw in the previous video, and the thumbs on the biting area. Then you rock gently back and forth, breaking the suction. And at that point, you gently remove the upper dentures. Some of the techniques we've talked already can work with dentures. And here is the hand-over-hand technique, which works very well when trying to remove dentures. See how I'm doing the lower dentures first? Bridging can also be applied to the activity of removing dentures. And again, a denture cup works, so would also an old denture. I would advise using the that you need now, but old ones, because if they get broken, it wouldn't be a big deal. Again, pantomiming and gestures, and the top dentures come out first. Remove the dentures, always check them for broken or missed teeth and rough edges. The dentures may need to be repaired or replaced at that point in time. People's mouths do shrink with age, especially when dentition is lost. If the dentures are loose-fitting, they may need to be resized and replaced with smaller ones. It can also be cleaned with special denture paste or liquid dishwashing detergent or soap. If you use dishwashing soap, please ensure you rinse thoroughly. Also, I'd like to take this time to recommend that dentures need to be removed overnight, at least 4 to 6 hours. And the reason behind that is when dentures are left in the mouth all the time, the tissues never get a chance to breathe, and you can have the risk of a fungus infection underneath the denture plate. And that can be extremely painful, and it takes a while to heal. Now, as for replacing dentures, they should be replaced in the opposite order they were removed. You put the upper ones in first, followed by the lower dentures. If the elder puts his or her dentures in by him or herself, the order doesn't matter as long as the person getting their dentures back in. And I have a video here to illustrate. Go in first, then the bottom. What's interesting is when you start putting the dentures in, a lot of the older adults seem to go on autopilot with manipulating their mouth and their tongue to get the snapped dentures back in. Now, the video clips from which I pulled this presentation, I have a whole video explaining how to provide mouth care to persons with dementia. It is about 30 minutes in length. It's available for free. That's the link. You have to register. The portal for online geriatric education is started for physicians, and that's included nurses and other healthcare providers, and the public can access it as well. A lot of what's on there is very technical, but this video posted on there. You do need to register, but it's free. And once you register, in search, type Jablonski and video, and the link should pop up. And again, the video is 30 minutes in length. It's free, and it reviews much of what we discussed today. Line is to be persistent and try all the different techniques. Some days you may experience success. Other days, toothbrushing may not happen. And brushing once a day is better than not brushing at all. But the take-home message is that any mouth care is better than no mouth care. We hope that we provide some concrete ways to approach mouth care with your loved ones. And Dr. Kolonowski and I want to thank you for your kind attention. And now we will take questions.
Rita, I have everyone on mute. I was going to get everyone to pose their questions through the chat box that says Q&A if you'd like to type in, or if we want to unmute everyone, that's up to you, Rita, if you do that.
Well, I mean, there are 75 attendees, so I'm not sure how like I can see, it might be easier if the people just type their questions right now.
Certainly. The first, and I was actually going to turn it over to Angela Taylor to be moderator for our question and answer period.
Okay.
Hi, everybody. Unfortunately, on my Q&A panel, I'm not able to see any of the questions today, so I think if Dr. Jablonski is able to see them, it would be fine for her just to see those herself.
So far, there's one that says, how do you control the biting of the toothbrush? We don't bite. Sometimes the people suck on the toothbrush, and when they start the toothbrush, we just say, you know, that's where distraction will come in. We'll hand them another toothbrush or talk to them about something else, and we distraction. But sometimes, I don't know if it's a reflex, but the people will bite down. We just do the best we can with the mouth care. Ultimately, the biting down does stop.
Rita, we've had tried a strategy in the clinical area, and that is to actually mimic the person who's biting down. If you insert a toothbrush in your mouth, bite down on it, but then open your mouth and say, ah, and hopefully that will initiate a reflex in your loved one to do the same thing. It's almost like a takeoff on mirror, mirror.
Okay. Thank you. The next question is, what about electric toothbrushes? If the person with LBD will tolerate an electric toothbrush, feel free to use it. Electric toothbrushes often enable you to get into spots quickly and really do a good job brushing. The thing with electric toothbrushes is, with dementia, people move backwards in time. So someone may have used an electric toothbrush and suddenly not want to use it anymore because they've literally forgotten about their experience with an electric toothbrush. We've less care-resistant behavior with a traditional manual toothbrush. My recommendation is use what works. And And it looks like some more Q&A here. I'm trying to, all right. How do I get a copy of the PowerPoint? I think it's on the website. I don't know if you can.
We will have it recorded, and in the next week we will have it up on the website and on our YouTube channel, which is, there's a link to our YouTube channel on the front page of our website.
This one is, how often should an elder with dementia be seen by a dentist? That really depends. Every 6 months, especially if the person has his or her own dentition. And I've been working with hygienists trying to teach them some of these techniques. You want to let the dentist and the staff know that the person has dementia. What they may do is have the person come later today when they're done seeing everybody else so they can take their time. If you know that a certain time of day is better for your family member, negotiate that with a dentist. And as for how often should dentures be replaced, again, if the dentures fit and there's no damage, you can keep using them. I've seen recommendations for 5 years. I've had people with dentures for 10 years. If the dentures fit and there's no abrasive areas, you can keep using them, but often what happens is over time the mouth shrinks and the dentures no longer fit, and the caregivers keep using adhesives, and that's an issue. The final question there is, what can you do if a person will not let the caregiver remove dentures? We have done a lot of different techniques, the pantomime, the distraction, hand over hand. This is going to sound absolutely terrible, but one way I've done it with my own family member is I waited till my grandfather was asleep, and he would start to snore, and I'd take the dentures out then, because the days I was going to lose a finger trying to get his dentures off. So I understand how difficult it is for the person to get dentures out. If you have the person with dementia remove his or her own dentures, that's the way to go, and that's why we use the hand over hand, the pantomime, the gestures. But ultimately, if you really if nothing works, snatching out while they're asleep. I know that's not pretty, but it does work. And I'm scrolling down. Is it okay to take my mom to the dentist for cleaning? And the answer is yes. Just let the dentist and the dental staff know about your mom has dementia. It would be amazing to find dentists who specialize in geriatrics, and that's often a difficult thing to do, but if you can. And the cleanings are fine as long as your mom can tolerate them. And I think I just want to. Okay. I chat.
Say to Rita and Ann that comment that said, very organized presentation, really enjoyed this, and I've gotten several positive comments, so I just wanted to say thank you so much to Dr. Jablonski and Ann Kolanowski, Dr. Ann Kolanowski as well, for this very informative presentation that I know will be a great resource for us as well on the website later. So thank you so much for the presentation.
You want us to do the Q&A?
Sure. If we have a few more, certainly.
Okay. There's the chat. One of the questions was, do the patients you see have Lewy body? What I did, I hired professional older actors because I did not think it was ethical to videotape someone with dementia, and we needed the actors to resist to a certain point. But the reality is, I go out all the time and I work with people with all types of dementia, and we are finding that these techniques do work. And again, Something may work one day and not work the other day, but you just keep trying. And there's a question about dental schools in the country providing information on working on with patients with dementia. I don't know. I do know that one of the reasons I was recruited here at UAB is there's individuals in the dental school interested in working with older adults and with people with dementia. And I do have to say that that's not a topic that's often covered very well. So I have a hard and fast answer to that one. The next question was, what if a loved one is too debilitated to go to a dentist? You can try to see if you can get a dentist or even a dental hygienist with dental supervision to come to the house. I honestly don't know how to go about that. Your best option is to keep doing good oral hygiene to prevent the progression of any dental issues. And another one, my husband has cavities and the dentist says he cannot fill them unless he has anesthesia. What do you suggest? Without really examining your husband and knowing, I don't know, because there's many different types of cavities. The question, are the cavities causing pain? How extensive are the cavities? And I would go to the dentist and ask those questions. Are we talking about small cavities? Are we talking about deep cavities? Are they on the top of the tooth? Are they on the roots? What anesthesia are you suggesting? And to get more information and find out from the dentist, well, if we do this, what are the risks and benefits to my husband? If we don't do this, what are the risks and benefits? So I apologize for not being able to give more focused information, but that's my recommendation. And then another one is the dentist said my mom's gums were in bad shape, so he said she had to swish her mouth with salt water and baking soda. It's hard to get her to do that at times. And the rationale for that is usually you have a lot of caries and a lot of problems with the teeth. It's because the environment is very acidic. And baking soda makes it a little less acidic, so the bacteria won't break the down and create acid. It's a way to improve the environment. And the option is to mimic it, for you to take the same liquid and say, okay, Mom, we're going to do this together, and you both stand at the sink, swish, and swallow. The fact that it tastes yucky is probably one of the issues with your mom not wanting to do it. So that's one way to do it, through mimicking. And the other thing is to try really hard to brush the teeth, because one situation with our residents in our nursing home study where we went to brush teeth the first time and the gums were mushy, they were bleeding, and that's because the gums are very, very swollen. After 1 week of consistent toothbrushing, the gums stopped bleeding. Sometimes family members are afraid to brush teeth because my dad spits in the sink or the spouse spits in the sink and they see a lot of blood. That's somewhat normal when you have mouth care as often as it needed to happen, because it's very hard to give mouth care to this population. So I recommend brushing teeth as much as possible and then using mind and gestures with the salt water and baking soda. And actually, there's a lot of questions. I want to make sure I answer everything. This question is it common practice for the dentist to give patients with dementia a form of anti-anxiety meds prior to teeth cleaning? Unfortunately, the answer to that is yes. And a lot of dentists do not understand that some of those anti-anxiety medications can actually cause a lot of what's called somnolence, a lot of sleepiness on the part of the patient, or may have the opposite effect. What I want to do is talk to the primary provider and maybe your primary provider could recommend something to be given prior to a visit to the dentist. The other thing is, I wish I could reach all the dental professionals out there and share these techniques, because if the dental hygienist or the dentist were to engage in some of these techniques, I think you'd have less negative behavior. In the office, the dentists usually work very quickly. There's not a lot of explanation. Some of the offenders I've experienced with elder speak are dental hygienists. And it did happen to me. I had someone talk to me like I was a cat, and I disavowed her of that. So the offices themselves can be problematic. And you can even suggest to the folks at the dental office to this video, and maybe they could watch it and figure out better ways to care for your family member. And okay, my mother advanced Lewy body dementia, and at this point her mouth care is spraying her mouth bacitracin. This is new. They're also trying to clean her mouth after meals. She's had thrush on and off. Not sure if there's anything else to do. That's weird, spraying the mouth with bacitracin. I'm not aware of that. Chlorhexidine is a better option. Chlorhexidine is an antibacterial agent that has been approved for use in people who cannot tolerate toothbrushing or it's very difficult to do. And I would prefer that to bacitracin. You may want to ask the folks caring for your mom to look at chlorhexidine instead. And please bear with me, there's questions on okay. Someone wrote that important with LBD individuals to not have Haldol, Mellaril, Felazine, Thorazine, drugs LBD are allergic to. As a clinician, those are drugs I would never, ever, ever want to prescribe for any of my older adults. But again, I would try to have have the people in the clinic to be aware of this video and to advocate for your loved one. I know all of you do that a lot. And if there was a way I could wave a magic wand and have all of my dental colleagues on board, but I'm trying. And I don't see any more questions.
Okay. Well, if don't have any final questions, I just want to thank Rita Ann again for a very informative presentation. Again, this will be available on the LBDA website, lbda.org, later this week. And if anyone has any questions, we had one question about getting presentation handouts. We do have the presentation, and it's the outline speaker's script that I can email you. If you'd like to email me at epatrick@lbda.org, or just give us a call at the office, and we can route you to the correct staff member if you have another question for us. So thank you so much again for joining us, and I think we'll wrap it up.
Okay, very much.
And thank you for the opportunity to present. I hope this was helpful.
Definitely, definitely. A lot of great questions as well. So thank you so much to everyone that participated today. Thanks for joining us, and definitely look out for our next webinars coming up. We have one coming up in October. So thank you so much.
Okay, thank you.
Bye-bye.